Good day, sir. I am Chris Tayopan, your nursing aide for today. And today we're going to demonstrate colostomy care, changing ostomy appliance. Assessment. For assessment, first we need to determine the following. The type of ostomy, the type of ostomy, and the placement on the abdomen. Next, the type and size of appliance that is currently used and the spatial barrier that is attached on the skin. Then we need to review the stoma considerations for color, size, and shape, the tendency, uh, bleeding tendency, and healing status per client's record prior to seeing the client. Then for planning, we need to gather all materials, equipments needed, and bring to the bedside of the client to save time and effort. So, all at the bedside is ready. Then for implementation, provide privacy by closing the curtain around the bed and close door if applicable. Then if uh, the if ambulatory, then we can assist the client to reach bathroom and in doing the whole procedure. Then we have to wash hands and then gloves. After applying gloves, um, we can we need to help the client to assume position that is we can based upon his choice, such as side lying, supine, or standing position. It depends on the client's mobility status. And if the client is wearing belt, we can ask her permission to unfasten it so that we can start. Then afterwards, we can um, remove the old colostomy pouch and wipe with washcloth. We can remove it slowly and gently. Then, after wiping it completely, we can assess the stoma if uh, and the peristomal skin integrity. Because sometimes the skin barrier and the skin barrier may be left in um, place if colostomy pouch is with a detachable faceplate. If so, we can difficulty remove it. But in my case, it was removed easily. And then we can place tissue or wipes if to the over the stoma, and we can change if needed. For easy and quick succession of procedure, we can prepare the materials we are needed ahead of time so that um, if we are going to do the procedure, we are ready for the personal seal. Then next, use the guide to measure the size of um, a skin barrier so that it will fit when we are going to apply it. So we have sizes here. We can size it so that we have guide when we are going to uh, make some as for the stoma. Then for the stoma opening. Then afterwards, um, if we get the right size, um, we can um, use it for the guide here so that we can apply it gently. Then after cutting the right size of the stoma that was trace circle, we can place it at the bedside so that afterwards it was ready. Then we are going to wash the skin gently using cleanser or washcloth and soak in mild soap. Then with water. And after doing that, we can um, proceed with rinsing it with clean water. Then after rinsing it with water, we can remove all secretions from the skin using a gauze toilet or tissue or washcloth. Afterwards, we can rinse soap thoroughly and um, make it dry or pat it dry gently. Then afterwards, if we observe some blood, just a small amount, we can tell to the client that it was normal. But if the blood is continuous, it was abnormal. So we can um, observe after uh, the pouch is in place. Then we can ask the encourage the client to observe the conditions, the skin, stoma, and the sutures, and until even if they are at home, um, we can ask the client to observe it. Before applying the colostomy bag or pouch, the skin must be dry. Then we can use a hair dryer. Just set it on cool to assist in drying. Then have the colostomy pouch ready by removing the backing from a barrier. Then after cleansing and drying the stoma, we can apply this um, gently so that we are careful. We avoid to harm the stoma. Then um, hold in place firmly 1 to 3 minutes. We can also use hypoallergenic soap for the stoma if needed. Um, then because some pouches are manufactured with tape in place, we can use the tape maybe optimal. Then afterwards, we need to fold the bottom of the pouch. This one, the bottom. We can fold this one, the edge, to fit the clamp. And after securing it, we can dispose the old ones, the old colostomy that we removed earlier in appropriate trash bin. Then we can remove the gloves and do hand hygiene. After performing hand hygiene, for evaluation, note we have to note um, the appearance of the stoma around the skin, then the incision, if any, while the pouch is removed and the skin is cleansed. Then report to the present healthcare provider the deviation from the normal. Then all the findings should be reported, and for documentation, um, we need to chart the type of pouch, what type of pouch we are using, and the skin barrier applied in nurse's notes. Afterwards, we have to record the amount and the appearance. The appearance is red and of fluent in the pouch. Then the size of stoma, the size is round. Then the color red, then the texture moist, then the condition of the personal skin and sutures. If there is, we have to take note. That's all. Thank you.